Welcome to the River Park Dental Show. This is Dr. Phing Saurer, and I'm here with Michael Morris.
Good to be here, Ping. It's always good to be here. We got a good topic today. Always.
Yes. It is a really exciting topic.
Yeah, you did actually perk up. Like a lot of my topics that I bring up, you go,
I'm like, boring.
Like if you're bored with it, that's the problem. If you're bored with it, it doesn't do us any good. But we were going to talk about sensitive teeth, but also whitening, because there's a lot of marketing, a lot of commercials on right now about everybody wants white teeth.
Yeah.
And actually, Rachel brought this up, that it was the first time she went to you to get whitening done. It was the first time her teeth didn't hurt from this. And I experienced the sensitive teeth issue from whitening for when I was getting married. So I attribute marriage to pain because of teeth whitening. Can you elaborate on that?
What part do you want me to elaborate on?
Not my marriage. Not my marriage. I want to talk about the tooth sensitivity in general.
I don't know what you want me to.
All right. So it seems I've stunned you, but let's take it from a dentist perspective. You see someone that comes in and I'm sure you hear people say, oh, my teeth are very sensitive.
I am one of those people.
All right. So you empathize a little with them.
Yeah. Yeah. And I have to eat things at room temperature, which really stinks.
What does that mean?
So I have to let my strawberries sit out before I bite into it, because otherwise that cold causes like a little zing or a pain. Because I have some So back to the sensitivity issue.
Yes.
A lot of people do have issues with teeth sensitivity.
But what causes that? That's just an inborn thing. That's just who you are. You have
no,
sensitive
because there's things that can contribute to it. So they may have recession. So that's when the root of the tooth is exposed, which can be more sensitive. They may have abrasion, which can come from actually brushing your teeth too hard. So where you're actually
too aggressive.
You're too aggressive. Or it can be from grinding your teeth, where you can start getting a little, like it looks like a little notch that's at the gum line. It looks notched
right.
out.
No, I wasn't. I was thinking about it. You looked at me while I was being
I wasn't
pensive.
sure if you were trying.
No, I was trying to think, do I have that?
Yeah. No, but then that's why we recommend using an electronic toothbrush, so that it can control the brushing for you instead of you.
The veracity of it?
Well, you just hold it. You just let it do the work for you. So you're not really brushing really hard. You're just letting it do it.
I'm an American. I'm going to do my own work. Thank you. But so you have this issue. So when you're treating people with it, you kind of know what they're already going through.
Yeah.
But do people identify themselves right away? Like, I feel like it would be a warning, like, just to let you know I have sensitive teeth. Like, this is going to hurt.
They do, especially to the hygienists. So we do have something where we can make the water warm, and that will help. But I also, if they do have like recession or sensitivity, I use a product that's a desensitizer that we put on the teeth. So actually, we'd had one patient that was whitening in office, and she said she never could get it done because her teeth would hurt. She only maybe did one round beforehand at another office, and she said it hurt so bad that she is afraid to do it.
Is that because of the trays? Because I know the issue I had was when you're getting that teeth whitening. What's the proper way to say it?
You're not just whitening one tooth. I was, right? Oh, you were?
No, I was not.
You only wanted one singular tooth to be white.
Yeah, just wanted that one molar. When you have those trays and you put that gel in, and then you're putting it in and sleeping overnight, and then you go to take that off, it's like trying to rip your own arm off. It was not a fun thing to have that air touch your teeth after all that time.
Yeah, it gets pretty sensitive. So what I recommend is people brush with Sensodyne 2 weeks before. So it has potassium nitrate, which I almost compare it to like teeth having pores. They don't really, but then the chemical in the Sensodyne helps block that so that the water doesn't go through and irritate the nerve. So Sensodyne, and then we place a desensitizer in office, which I put on every 6 months. I can tell when it starts to wear off. And then
what do you mean by that? You put it on. What is it?
It's called Huraseal. So it's just a desensitizer. You paint it on right in the areas that I have the recession.
I've never heard of that.
Yeah. And then, but what I was saying with the one girl that had sensitivity, we actually put on 3 layers of the desensitizer first before we whitened her teeth. And she said it helped a lot. She was able to go through the entire whitening procedure.
So, just some of the causes that you've kind of touched on, the cost.
And we don't charge for that too. So we just do it
but
as a
you'd have to
courtesy.
know to ask for it, right?
No, well, no, they'll bring it up to the hygienist. So if they,
So
or-
Missy would know, or whoever is cleaning our teeth would know they have sensitive teeth because they tell them,
Yeah.
and then that's an
or they
option
ask
to
them
use.
too. We always ask before we do any work.
But that would be done before you get to them, right?
Yeah.
Because they have to do their cleaning and all that,
Right.
and the exams. What I wanted to do was kind of talk about you mentioned a couple of these, but the causes of sensitive teeth were tooth decay, which you kind of covered a little bit.
Yeah.
Worn fillings, which how often is that, and how the fillings over time I know kind of have to be.
They do get worn down. But if you're, say, so let's talk about the anatomy of a tooth. Shall
Yes,
we?
let's do. Pull up a cup of coffee and let's talk about the anatomy of a tooth.
So a tooth has the enamel, everyone's aware. So that's like the hardest part of a tooth. When you have enamel wear, or what's the second layer of tooth is called dentin. It's a little bit softer. It's definitely more sensitive. And then if you have root exposure, that's more sensitive as well. So if you have decay in those areas, then you're going to obviously have the pain. But the enamel, once that is worn out, then you're going to have a lot of the sensitivity.
Okay, so you stole a couple of mine. I had exposed tooth root, right? And then we have worn tooth enamel, and that is just over time, right?
Yeah, so it's like worn tooth enamel could be from brushing too aggressively, from grinding your teeth, from fillings just being worn down.
What when you have fractured teeth, because that's the other one on this list, where does that kind of come from? Is that just you didn't maintain, it didn't get your hygiene done well enough, or tooth just cracks because it cracks?
Sometimes it cracks. So if you've had a root canal, so when you get the nerve taken out, the tooth just becomes a little bit more brittle. But when you've had fillings done in it, you're just compromising the strength of the tooth. So over time, the tooth will break down because, when you're putting a filling in, you're creating a big hole, and then you're just putting like a resin in there.
Right.
Not amalgam.
When you do put a resin in there, though, I forget what it's called.
Composite?
Yes, but when you're doing that, does that actually strengthen the tooth, or is that more just to avoid decay? What I'm saying is, I'm trying to think of the term.
So what people used to put when they had fillings was amalgam, so the silver fillings. Now, most likely, everyone that you go to, generally people aren't using amalgam anymore. I think everyone's starting to use composite. I believe so.
But when they're doing that is for the structural portion of the tooth, or is that to
no?
avoid
So
decay?
amalgam, how it was placed was all mechanical. So you would have to prepare the tooth a certain way, and then you're basically putting that amalgam in that hole that you create. With composite, it's both mechanical and chemical. So you are bonding the teeth together. So it doesn't give it. I wouldn't say it's definitely better than amalgam, because with amalgam you're relying solely on mechanical strength. But with composite, you're doing both. So it can hold things together a little bit better.
The last piece of this was gum disease.
Periodontal disease?
Well, this is gum disease, but you're the doctor.
Gingivitis?
Okay, but
am I going to keep on throwing words out?
Well, here's my question. How are those different things? Because we've talked about a couple of different issues. Is gingivitis different than gum disease, different than periodontal disease?
Yeah, well, gingivitis, a lot of people have gingivitis.
I know some of them, terrible people.
But it's inflammation of your gums. So you have gums that are bleeding. Best way to fix that is by flossing regularly and brushing, obviously. With periodontal disease, there is a little bit, it's more, there's bone loss with that inflammation. So it's a little bit different. And it can progress from gingivitis to periodontitis.
Nobody wants that.
No.
So when you're treating people, I'm sure we talked about, I thought you called it Botox before. You're seeing a lot of people coming in that are getting, you did do?
I did do.
I did see that. You're seeing a lot of people come in for more like elective procedures, but it seems to be whitening is like the biggest thing. everybody wants the white teeth and they're willing to do whatever to get it.
Yeah.
Are you seeing a lot of people that are coming in for the quick and easy solution? Or, I mean, there's some that take a little longer, and there's some that are just kind of like, I want to get my glamour shot this weekend, fix this up for a couple days.
Yeah, so we have 3 options in our office. So the first one is in office. So that takes about an hour and a half in the office. And it's for people that don't want to come in, who don't want to have to like remember to wear trays and like do it at home, and because you have to do many more days of it. So they just want it to be one and done, and then just maintain it. And they get trays with that too. So we'll digitally scan their teeth and then make them trays to take home, but we'll whiten in office to the color they
for
they
90
want.
minutes though.
For around 90 minutes, yeah. And that's $450.
For 90 minutes? That doesn't seem like very much for 90 minutes, because it's a lot of those solutions that they offer.
It's a higher concentration, so we definitely want to watch. We do monitor very carefully because the concentration of peroxide is so high, you don't want it to burn gum tissue or lips or anything like that. So that's something that has to be done in office. But that's why you get a better result, because it's such a high concentration.
Right.
Most people, though, don't usually opt for that. But with that, you also get custom trays that we send home with you.
So they can do it more
So that's
frequently?
for maintenance then.
Okay.
Yeah. So then, and maintenance just depends on your lifestyle. So if you're a coffee drinker, wine drinker, smoker, anything like that, you may have to maintain a little bit more than someone who doesn't do any of those things. The option that people I think pick most in our office is the custom trays. And that's $125. But you come in, we do a digital scan of your teeth, we print out the models. And the nice thing about the digital scan is that we have it on file. So say you did lose your trays and stuff, we can just make new ones without having to find stone casts. And then you can buy just the syringes, and then you do it at home. And you just put a little dot, and it lasts for a while. You don't use a whole syringe for each whitening. You put a little dot into the tray.
Yes, I remember that. And that's the part where I was really
Did you whiten your gums?
Oh, I almost whitened my whole face because I was not quite sure of how much to use. So I thought it was kind of like...
You squirted it all in.
Well,
yeah.
like when I was a kid and you got like a mouth guard to play sports, you always do that thing where you put it in your mouth and then you put it in scalding hot water and put it right back in your mouth because you're not paying attention to the directions.
Oh.
You know what I mean? So you're
yeah.
like, but this will really work. Or you put too much of that gel in, so it's either like super white. It only lasted for about 7.5 years. It was longer than the marriage, so that was good. When people are coming in for those, I don't want to call them elective. I'm calling it elective because it's like you're putting money into something for looks, for the aesthetics. And so when you're getting people coming in, are they kind of asking for a laundry list of the things that you can do? You know what I mean? Like, can you do teeth whitening? You said you do Botox.
Yeah.
Or sorry, Brotox.
Botox.
But you'll do it for women too, right?
Yeah. Mostly women get it.
But
we call it Brotox just so
because some guys are getting it.
Yeah. But the best part about Botox in the dental office is no one has to know. So a lot of people like to get things done without having, like if you're coming out of a plastic surgeon office, people know you got something done. You know?
Yeah. I used to work with one and it was, no one was smiling a lot when they were walking out. I mean, I'm sure it looked good after a while, but they all look like, the look that somebody has when they've like lost something important. That's kind of what it was. It was like their eyebrows are very fixed and they just went right to the car and went home. But yeah, you're right. I mean, I guess you could get this elective procedure done. But what started that? Did you see that in another office?
No. Well, I initially did Botox because for more TMJ issues. So I put Botox in my masseter muscle to help me from grinding.
I didn't know that you could do that.
Yeah. So
wait, you did that?
I do it to myself in a mirror.
You do it to yourself in a mirror.
I know. That's weird, right?
You have people that work at your office. They could help you.
No, but they can't inject it Botox. All I do is I just look in a mirror and I make a little mark and then I stick the needle in and then just put it in.
I'm looking at the side of your face and there are no wrinkles just in that area. So it is working.
So
I don't know about the TMJ part.
Botox helps relax the muscle. That's basically what it does. So you can use it for headaches. You can use it. I mean, people have heard it for, sweating in the armpits. I stay up in the head and neck region. So but I do it for my grinding because I can't wear a night guard. It always ends up on the floor or on my
like a boxer
nightstand.
that gets knocked out, it just falls out of your
Yeah,
mouth?
like I wake up and it's not like it's just I must
It's gone.
throw it somewhere. I don't know where it goes, but it just comes out. So, but I grind my teeth during the day too. So you're not going to wear a night guard during the day because then you're like.
So that explains the sensitive teeth issue that you're constantly grinding.
Yeah, I'm always.
Why are you grinding during the day? This is not a question for a doctor. This is a question for my friend. Why are you grinding during the day?
Because
like you're doing it?
I notice what I do it actually when I'm doing dental procedures because I'm so focused that like I just clench.
Right.
And I don't even notice that I'm doing it until afterwards. My jaw like is so sore.
Yeah. You learn something new every day doing a radio show with somebody. That's gotta hurt.
It just gives me a headache. It does. So like my jaw will hurt and then I get a headache and so it's nice for me with Botox in my masseter because then I don't have to worry about wearing a night guard and it protects me throughout the day. The only downside is around every 3 months I have to give myself injections.
Wow. I'm fascinated. This started with sensitive teeth and whitening, and now I've learned about your mandibular joint.
But I'm grinding my teeth, and I'm getting those little, what I had talked to you before about, like those notches in my teeth from grinding. So my teeth are sensitive. So it kind of goes all the way around.
Yeah,
right?
but you have nice teeth, so you're grinding them away, but they look great.
Oh, thanks.
We're going to take a break right here. You listen to the River Park Dental Show.
Do you dread going to the dentist because you hate getting shots? I'm Dr. Phing Saurer, and I'm excited to share a needle-free solution with you at River Park Dental. I use the Celea laser, the latest advancement in the dental field, to perform many procedures. No needles, no drill, and no more fear. Come see me and my team at River Park Dental. To learn more, visit us at riverparkdental.com. River Park Dental, where we practice tomorrow's dentistry today.
This is Dr. Dan Reed, DC, at Mission Chiropractic and Wellness. If you are pregnant and strive for optimal health during pregnancy, labor, and post-birth, call us today. Mission Chiropractic specializes in chiropractic pregnancy care, and research shows chiropractic is the safest alternative for expecting mothers to improve discomfort during pregnancy and overall health outcomes for the mother and child. Schedule an appointment at our office. Call us at 614-559-8666 or get us online at getmissionchiropractic.com.
HouseTrends.com, the perfect place for you if you enjoy looking at beautiful homes and outdoor living spaces. Their stunning photos and articles focus on local Central Ohio residential building and remodeling projects with plenty of kitchen, bedroom, interior design, and landscaping ideas. You'll also discover exciting options in home design and furnishings. HouseTrends.com adds new content daily. Sign up to receive their online edition and check out past issues too. Go to HouseTrends.com and click on Columbus.
I'm Dr. Phing Saurer, your dentist at Bridge Park. Have you ever been to a dental office and received bad news? Then you were told to see a different dentist with a different set of financial policies at an inconvenient location? At River Park Dental, once you become our patient, we won't ask you to see anyone else. My team and I are highly experienced and are proud to offer all services for you and your entire family under one roof. To learn more, visit us at riverparkdental.com. River Park Dental, where we practice tomorrow's dentistry today.
Hi, this is Jeff with Myers Jewelers. If you're in the market for a Tacori engagement ring and or wedding band, let Myers Jewelers be your one-stop Tacori destination. Myers Jewelers has the largest selection of both Tacori engagement and wedding bands in Central Ohio. We also are the exclusive Tacori dealer for the exquisite Royalty Collection. We also have a multi-million-dollar selection of certified loose diamonds in every shape, size, and quality as well. Come visit the family on Stringtown Road in Grove City and experience Myers Jewelers.
Are you an outdoor person? Do you want to do creative work? Check out the job opportunities at Greenscapes Landscape Company. We are now hiring for our new Northwest location near Dublin. No experience necessary, just a great attitude. We offer great pay, health insurance, and a company matching 401k plan. Go to greenscapes.net for an online application or call Sandy at 614-837-1869. Greenscapes is an equal opportunity employer.
Hi, I'm Dr. Phing Saurer, owner of River Park Dental. My team and I provide tongue and lip tie releases with a CO2 laser for babies struggling to nurse. We understand how stressful this can be. To make it easier for you, we bill our fee to most medical insurances. That way you can focus your time on what's important, you and your baby. We are proud to be your local provider. To learn more, visit us at riverparkdental.com. River Park Dental, where we practice tomorrow's dentistry today.
Mrs. Johnson, we regret to inform you that your husband and children have been severely injured in a car collision.
It's the phone call you fear. You must act quickly to help your family. You must act quickly to find someone to protect you from the legal and insurance problems to come. At Scott Elliott Smith Law, we've been successful protecting families from insurance companies for over 35 years. Visit us online at sestriallaw.com. Get Scott Smith. Get justice.
Welcome back to the River Park Dental Show.
Doc, I figured out the word I was trying to come up with, and I'm going to get it out. So if someone was watching on Facebook, you heard me say sealant 10,000 times. When you were talking about fillings, I was trying
You were thinking about sealants.
Yes, but I could not come up with the term. And now I've got it, and now I used it, and now we can move on.
Okay.
I just had to get that out.
Do you want
I want
me
you to
talk
explain-
briefly what a
Yeah.
sealant is?
I would like you to talk briefly about it. I just came up with the word. What is a sealant?
So usually for kids, when we're checking their molars and they have teeth that are very, we call groovy or deep, where they're groovy.
They're groovy. They're gnarly.
The deep grooves in the teeth, then we'll put a sealant in there to kind of help protect, because if they're really deep, food would get stuck in there and they may not be the best brushers, and it's just a preventative measure.
But adults can get sealant as well.
Yeah. Insurance just doesn't cover that. Insurance will cover for kids.
It's kind of pricey as an adult, right?
I think it's, if
I'm extremely cheap, so I'm just saying it's
I
not
actually
something you
don't
go in
know.
and go, it's only $100 and they'll do all your teeth.
I think a lot of adults are doing it. They're definitely getting the fluoride treatment for sure.
Okay, but you're getting ahead because I want to talk about fluoride because there's a little debate and we only have like 8 minutes of show.
Yeah.
So I don't want to debate it a long time. But I just want to point out that sealant, 1, was the word I couldn't come up with. 2, it's an option.
Yes.
So you can get it as an adult.
You can get it as an adult.
Is that more of an elective type thing to do? It's not covered by insurance as an adult, so it's kind of, is that along the lines of Botox?
Yes.
Easy answer right there. Now I want to go on fluoride. So fluoride is good, right? It's a positive.
Yes.
But people are not getting enough fluoride or the right amounts because of drinking bottled water was something that we were kind of talking about off the air.
Yeah. So I think they had seen actually a rise in cavities I think they linked it to people drinking more from bottled water.
When you were a kid, I remember, and again, I'm 42 years old, and I know I look like 30, but when I was a kid, they started this fluoride treatment. They would make you do it in school. Like they would bring it around to classrooms. Maybe this was just
We're close to the same age. I do not remember this. Maybe my school
I went
wasn't
to
very.
Grove City schools, and that's a higher class of individual. I mean, as I always say, Grove City is the New Albany of the South.
Okay.
Of Columbus, but they had us do fluoride treatments, and it was like every day at the same time, and the entire school was doing it. And
Really?
I remember that I want to say it was 1st or 2nd grade. It was like mandated. That's what we were doing. Now I can't say every other school did it. But we were exposed to fluoride early on. So as a kid, I just always thought that's what everybody did. But it turns out not everybody's exposed to that. It looks like you're kind of jealous because I went to school that had fluoride.
I'm like, you had fluoride at your.
Well, we're very rich down there.
I had no such kind of treatment.
But at what point people are not going to switch from their habit of bottled water now? I mean, you're buying this
Yeah, but
Nestle
toothpaste has fluoride.
Correct. But isn't it more beneficial to drink tap water and get some fluoride in your mouth than to drink bottled water all day? It's not causing cavities because it's water. It's just it doesn't have the fluoride in to protect it.
Bottled water, correct.
Right.
Yeah.
But
like you had asked if fluoride was toxic, and it can be if you're eating it. If you're eating your toothpaste, then you.
Well, first of all, I think we should phrase it the way that I said it. What I meant was there was some controversy about adding things to the water in a city.
Yeah, and they've done a lot of research to give just enough for it to be good and not something that's going to be detrimental or toxic.
I just always, when someone says they want to add things to the water, I'm always very cautious. I'm very conspiracy theory about things.
Yeah, but when they did, the incidence of cavities went down really low, but then it increased again with bottled water.
Right, but when I was reading that study, because again, conspiracy theory, I got to know this stuff. So people were afraid. What they heard was you added a chemical to the water.
Yeah,
so then they started drinking bottled water. Like, you're not going to get me. Well, what do you think you're swimming in, or what do you think you're, bathing in? You're drinking. That's the same water.
Yeah,
unless they were using a lot of bottled water to bathe in, and that could happen.
That could happen.
I've been to a campground. It's disgusting. So we kind of covered the fluoride part, but you recommend that as well. So if you have sensitive teeth,
fluoride can actually help with sensitive teeth as well.
In what way?
Because it helps build up your teeth.
It would protect the enamel, right?
Right. And with kids, we recommend once they can spit their toothbrush, but actually you're supposed to put just a little smear, so it's not the pea-side amount anymore. It's just a little smear, even for babies, for little kids when they start getting their teeth.
A smear of what? Fluoride?
No, a toothpaste.
Oh.
Yeah.
Well, you did say you want a toothpaste that has fluoride. What would you recommend? I want you to be like, they always say 4 out of 5 dentists recommend. I want you to give your recommendation.
I've never been asked to recommend anything. I don't know.
Like,
I want to
meet. The field. You must know a lot of other dentists, and they've never been asked this question. I want to know who
all these other people are.
Well, technically, I just asked you. So 1 out of 1 dentist, what would you recommend?
Are you asking what I use?
I'm not asking Jim. He's producing the show. I'm asking you as a dentist. No, you know what? Jim, what do you use?
Crest.
He uses Crest. Do you recommend Crest?
Yeah.
Okay. So that's if somebody was asking.
I think any of the toothpaste that has fluoride.
You're very definitive about that. Okay.
There's Colgate, there's Crest, there's Sensodyne, there's so many of them.
Here's the key that I want to cover because we're almost out of time this week. When you're looking at people that have sensitive teeth, you are sensitive to this issue because you have the same issue, right?
Yes.
So
I would love to find a cure, but there is no cure.
Okay, but if there's no cure, there is a place they can go and be treated.
Yeah.
And that would be
at our practice, River Park Dental.
Right. And
like I said, we do it as a courtesy. So if you have recession,
say that part again. What you give them, there's no extra charge.
We don't charge you for So if you have sensitive teeth and you have recession or anything like that, we do at the cleaning. We'll put the desensitizer on as a courtesy.
Okay. And you're taking anybody, all comers right now, right?
Anyone can come.
Even if you don't have sensitive teeth.
Even if you don't have sensitive teeth, yeah. Even if you have one tooth, you can come. No teeth. Yeah, dentures.
Yeah, good point.
And oral cancer screenings.
Oh, yeah. That's an everyday thing.
Yeah.
Yeah, Missy was big on that. Yep. We had Missy on it a few weeks ago, and she was big on the oral cancer screenings. A little too much. She was a little too pumped up to want to do that. I mean, in a good way. Like, she was like, yep, I can't wait.
Well, wouldn't you want someone who cared?
I mean, in my life, sure. As a hygienist, even more so. But yeah, I think that's an important thing because now it is May and we're talking about this.
Yes.
April was when we were talking about oral cancer
That's the month,
screenings.
yes.
Right. But we're ignoring that. It's every day.
It's every day.
At River Park, it's oral cancer screening every
day.
Do you want to leave anybody with some parting wisdom? I know you're getting ready to, in a few weeks, to go to your 40 under 40.
Yes.
You're getting your photo shoot done.
I know.
Big deal. Will we be able to see that on the website?
What, the photo shoot?
Yes, not the audio part, but the photo shoot. Will we be able to see that on the website?
I don't know. I don't know how this all works.
You should take your iPhone with you and maybe take some selfies from the set.
Yes, so my brother-in-law will be there and he will be taking photos. I already gave him the job of photography with my iPhone.
All right.
So check it out on Insta Stories.
Yes, well, you've heard it here first. Yeah. Our 40 under 40 in a couple weeks is going to be going down there.
Yep.
We're going to have plenty of photographic evidence that it did happen.
Yes.
All right, Phing, well, that's it for this week. Why don't you sign us off?
Well, thank you for listening to the River Park Dental Show.
You've been listening to a Morris Media production.